My name is Nicki Meyer. I'm a nurse practitioner student. Today we are doing the HEENT health assessment. I'm just washing my hands here. We have a 26-year-old male Caucasian presenting with complaints of ear pain. Hi Stephen, how are you feeling?
Good, how are you?
Good, so tell me what brings you in today.
My right ear is it's killing me.
Your ear, anything else going on? Cold?
Yeah, I've had a little bit of a cold over the last week.
It's that year, that time of year.
Yeah.
When did this cold start?
About a week ago.
Any other cold symptoms like the sore throat, cough, runny nose?
Scratchy throat.
Any ear pain?
Well, I mean, yeah, my ear's been hurting, yeah.
Is it radiating anywhere?
Not really, no.
Can you describe the pain to me? A pressure, stabbing, fullness?
Kind of like a fullness, I guess.
What about the left ear? Any popping or any other symptoms?
No, it's fine.
What about headache?
Nope.
Any trauma recently?
Not that I know of.
As far as cleaning your ears, do you clean your ears at all?
About twice a day.
Activity-wise, are you a swimmer?
Nope.
No? Any water activities lately?
Well, scuba diving, yeah.
Oh, okay. How long ago was that?
Just a few days ago.
Were you traveling somewhere?
Yeah, we were down in Florida.
Did you fly?
Yeah.
How long ago did you get back?
Just the day before yesterday.
So have you had these cold symptoms since the trip?
I actually had the cold symptoms before the trip.
So when did the ear pain start? During the trip?
Pretty much, yeah.
As soon as you got there?
Yeah.
Yeah. Well, have you had anything that makes it worse or makes it better?
No, not really.
What have you tried anything over the counter?
I've been taking some ibuprofen and Tylenol for the cold, yeah.
How often are you taking that?
Probably about twice a day.
1 tab, 2 tabs?
I think like 2.
Okay. Any new medications that you've started?
Nope.
And have you been around anyone who's been sick?
No, not that I know of.
And with flu season, are you up to date on your vaccinations?
Yes.
Have you gotten your flu shot?
Yes.
How long ago was that?
A couple weeks ago.
Have you ever had symptoms like this before?
Nope.
About as far as ear or even with vaccinations?
Nope.
No. Tell me more about your medical history.
Not much to tell. No. Don't really have any. Don't take any medicines.
Surgeries?
Nope.
Social work-wise, what do you do for work?
I work around helicopters.
You wear your ear protection?
Yep.
Okay. Any other loud noises that you were around possibly in Florida?
Not really.
And what as far as family history, what about your mom and dad?
They're healthy.
And symptoms, or your siblings at all?
Nope, they're all healthy.
All healthy?
Mm-hmm.
Okay. Well, besides your ear pain, any body aches, chills, fevers?
No, not that I noticed.
Anything else abnormal that you've noticed at home? As far as unable to do other activities?
No.
No?
Mm-hmm.
Okay. Upon presentation, patient's vital signs are as listed. 118/70 is blood pressure. Heart rate is 86. Respiration's 18. And temperature 98.9. Alright, well let me go ahead and take a quick listen to you. Have you been coughing at all?
A little bit.
Coughing up anything?
Nope.
What about sore throat?
Yeah, a little bit of one.
You still have a sore throat?
No, not really.
Any redness or swelling, tonsils that you've noticed?
Not that I've noticed.
No? Okay. Big deep breath. Big deep breath. Yeah. And hold your breath for me for a moment. Okay, breathe normal. Let's look back your lungs. Big deep breath. Good. Upon auscultation of the lung fields, lungs are clear, no adventitious sounds are noted. Upon assessment of the heart, S1 and S2 are present, no clicks, rubs, or murmurs are noted. How long have you had this sore throat?
About a week.
Okay, well let me take a look at everything. We might have some enlarged lymph nodes. I'm going to be pressing around and we'll look at your eyes, nose, ears. First, just going to take a look under your eyes. Can you look up for me? And look down, back and forth. Good. Upon assessment of the eye, there is no drainage, erythema, or swelling nodules noted. No exudate. Sclera is white, clear, and moist. I'll take a quick look Pupils, just make sure we got good response. Pupils are direct and consensual to light as well. Let's take a look at your nose. Are you still having the stuffy nose at all?
Not so much, it's about cleared out.
Okay. Upon external assessment of the nose, septum is midline, nose is pink, moist, mucosal turbinates are intact, no protrusions or lesions. No exudate is noted on the nasal cavities. That's good. And then I'll have you open your mouth and say ah. Looking for the mucosa of. Alright. Mucosa is pink, moist, no exudate noted on the back of your throat or your tonsils. Tonsils are +1 as far as enlargement, so just a little bit of swelling could be normal for you as well though. Your tongue is midline, uvula is midline, and the palate rises, which is expected. Your teeth and gingiva are clear and clean, no signs of ulcerations, exudate, or swelling are noted. And just take a look at your lymph nodes here. My hands are cold, just feeling for any swelling, lumps, nodules, tenderness. Feel the anterior ocular and the posterior. On the patient's right side, we do have some swelling noted, some tenderness behind your ear. And go down here to the submandibular, subtemporal, and the cervical lymph nodes. Have some swelling, but more on the right and the cervical lymph nodes. And we'll do the posterior cervical, and the supraclavicular is not palpable, which is as expected. And we'll take a look at your ears. Upon external inspection of the left ear is pink, moist, intact, no drainage or erythema noted. And any tenderness when I touch your ear?
Nope.
No? What about when I tug on it?
Nope.
Good. Take a look at it in the ear canal. Ear canal is pink, moist, minimal earwax, yellow, orange, thick but no drainage. Tympanic membrane is pearly gray, intact. Features of tympanic membrane are easily made out. No bulging is noted. So your ear canal is clear and clean and pink, looking good. So normal ear here. On the left, take a look on the right, and then we'll check your hearing.
Okay.
So on the external examination of the right ear is pink, moist, intact, no exudate or drainage or erythema nodules are noted. And any tenderness when I touch your ear?
No.
No? What about when I tug on it?
No.
No? Good. On examination of the internal canal, we have no drainage, however it is swollen. We've got some erythema noted. Tympanic membrane is intact, however it is bulging, red, and a little swollen. But does appear to be intact, which is good. We'll check your hearing out here. We'll do what we call the whisper test. I'll whisper some letters and numbers and you just repeat my findings, okay?
Okay. 582. I think I heard a 5. I don't really hear well.
Alright, we'll do one last test. Well, this is called the Rhine test. Tell me when you can stop hearing it. I'll just put this on your mastoid bone here. I'll time you.
Okay. Okay, I can't hear it anymore.
Alright, so upon assessment of the right ear, findings do have some conductive hearing loss where bone conduction is more than air. Normal is the 2-to-1 ratio with air being longer heard than the bone. And we'll assess the other side here, same thing.
Okay. Yep, stopped.
Alright, so normal hearing on the left where air conduction is twice as long as bone conduction, which is as expected. For your right ear canal, if there's anything going on, there might be something with that ear canal or tympanic membrane. So with your history of using the cotton swabs, you might have some type of foreign body in there. From cleaning it out, that might have made that red and irritated in the fullness. So another option, especially with the cold symptoms, we're looking at an earache or otitis media. And then another thing with the flying and the scuba diving and the pressure, especially with the loud noises too, that can damage hearing. So those are mainly my abnormal findings, if you will. And upon assessment of this patient, my 3 differential diagnoses would be acute otitis media, barotrauma, or foreign object or foreign body. Thank you.